That was a great talk. We have Dr. Prasad here joining us, and hopefully there he is. Hello, my friend. Thank you
Hello.
for the wonderful presentation.
Thank you for having me.
We have a lot of questions, but not a lot of time. And I know that you are soon off to give a lecture in Africa. So you're going to be leaving the country soon. So I want to get these questions into you immediately. So I'm going to start with, how can someone prioritize wellness when they have multiple competing demands like work, family, social commitments? Where do they start?
So how to prioritize wellness with it, especially because we have all those competing factors. I think that's the reason why we need to have that wellness. And so I wouldn't say that wellness is something that um, is an addition to that. I would say wellness is something that is embedded among all those things, right? In all those different domains, we want to have make sure that we're taking care of ourselves in those different domains. And so wellness would really be something that should permeate in all those different domains. So how would you prioritize it? I would say it definitely should be a priority, but it's not necessarily let me do my wellness first, and then I'll worry about work stuff, then I'll worry about family stuff. As you take care of your wellness, it should be something that ends up permeating all those different domains in your life.
So to follow that, we had a question about several questions about all the different facets of wellness and being resilient. And you noted that diet and exercise, both physical exercise and mental exercise, is important. If you're someone who really hasn't approached that in an assertive or even an introductory way, which one should you start with first?
Which one in terms of exercise or
Diet,
diet?
physical exercise, mental exercise.
I would say whichever one is the easiest for you, because if you start with something that feels insurmountable, like say, for example, if exercise has never been a part of life for you and you tell yourself, I'm going to go and I'm going to um, jog for an hour every day, that can seem like such a dramatic shift that the burden that it places on you is very significant. But with diet, for example, if it's something where you say, you know what, I'm just going to cut back and not have, I'm going to cut back on one soda a day, right? Then that might be easier. Or with exercise, if that is a big task, then break it down into smaller pieces. I'm just going to start by taking the stairs at work instead of taking the elevator. So with any of the areas that you start with, there's no sequence in what you should do. It's just whatever is the easiest for you, but try to find spaces that make sense. Try to find areas that will be easier for you to do that'll maximize your success. And when you're not successful, don't be hard on yourself. Anytime that we make changes in our lives, it can be stressful. And our brains and our bodies like to kind of stick with what's familiar, even if that's not the healthiest thing for us. And so it's an effortful process to try to do some of these different things. We take 2 steps forward, 3 steps back, 2 steps forward, 1 step back, but that's just how growth occurs.
So just following on that, kind of the inverse, what are in your practice, in your experience, what are the emotional barriers that you see that people present with that impair their ability to start those changes?
So some of the emotional barriers that can get in the way. So at the most extreme level, I would say just from a clinical perspective, if people do have significant depression, significant anxiety at a clinical stage, that can certainly be a barrier. A lot of times it can also be if somebody they know that they're feeling something, but they can't quite understand what it is. So not necessarily a clinical depression or anxiety, but just some tendencies toward depression, tendencies toward anxiety, where they know there's some pattern that's occurring in my life that's maladaptive, but I don't quite know what it is. I don't know why I'm getting these outcomes that aren't satisfactory to me, and people end up feeling stuck. And so that's one of the biggest barriers that I think that people have. Those two things, either kind of on the more extreme where there's a true clinical issue, or just kind of that feeling of I don't know how to move forward from here. I know something needs to change. I want something to change, but I don't know how.
Well, here's one that I have insomnia that undermines my wellness practices. Will any of these tips that you've given us help me sleep?
Yeah, sleep is something that I think really gets addressed in our overall healthcare. If you don't get a good night's rest, everything is going to be off kilter the next day. Your physical functioning, your emotional functioning. But with sleep, there's a wide range of different factors that can influence. It's rarely just one or two things that are contributing to sleep. And again, with that, I would look at some of the low-hanging fruit. What are some of the small changes you can make to try to address that? In terms of the things that we talked about today, there are some of the strategies that you can use to try to improve sleep. A lot of times people have a very overactive mind that interferes with the ability to fall asleep at night. So doing some of the breathing exercises can be helpful. If there's a lot of self-critical thinking that happens at night or a lot of worrisome thoughts, you can try to do some of the cognitive restructuring work before you go to bed, and then try to do some of the breathing exercises to help yourself get into a calmer state so that sleep can come from that. So, simple answer. Yes, you can use some of these strategies, but it'll likely take a lot of repetition and a lot of time to see the benefits from them.
Okay, here's a final difficult question. I'm a 78-year-old caretaker of a 92-year-old homebound elder. How do I stay focused and avoid absorbing the stress that's all around me?
That's a great question. So, taking care of others can be an exceptionally challenging thing. So, one of the most important things to do, you want to make sure you're taking care of yourself as you're taking care of that other person. And there's nothing selfish about self-care. A lot of times people feel like if they take a few moments for themselves that there's something greedy about that. And it's absolutely not the case, because the reality is if you don't take that time to take care of yourself, there's not going to be enough of you there to take care of that 92-year-old person. So make sure that you're taking some time out for yourself. And that might be that you start off the day just looking at the time that you've got allocated and carving out little pieces that you can have for yourself. And it may not be that, okay, I'm going to have 1 hour that's just focused on myself. It may be that, just during lunch, I'm going to steal a couple of minutes away. I'm going to add a couple of minutes here and there just to make sure that I'm focusing on me. But start there and build up from that. But it's critically important to make sure you're doing that to make sure you're maintaining your own well-being. And
Dr.
it's easier said than done.
Yeah. Dr. Prasad, I want to thank you for a wonderful talk. And I know that we could stay here for an hour or so asking you questions or more. We'll let you get on your way. Safe travels, and thank you for joining us.
Thank you very much for having me. I appreciate it. And thank you everybody for watching the presentation.